Welcome to We Help You Home, the podcast where we share real stories, practical advice, and tools to help seniors thrive at home. We're also here to support the amazing caregivers that walk this journey with them. I'm your host today, Rob Steinbrook, and today we're diving into a topic that's essential for anyone supporting a loved one at home, and the topic is safety. Home safety isn't just about fall-proofing or installing a grab bar. It's about creating an environment where seniors can live securely, independently, and with dignity. Joining me today is Denette Buenrostro, a licensed registered nurse and the branch manager for ATEX Home Health and Hospice Company. Denette has helped hundreds of families navigate the challenges of aging in place, and she's here to share practical tips, common risks, and the kinds of support that make a real difference in people's lives. Thank you so much for being here today, Denette.
Thank you for having me.
Can you start by telling us a little about your background and what brought you into home health and hospice work?
Yes, absolutely. As a young nurse, I wasn't exactly sure what I wanted to do once I graduated, and I had a neighbor who I had noticed had been falling quite a bit and needed some type of care. And I noticed that there were nurses that were going to her home to visit her, and I kind of popped in and asked them, what they were doing, and they said that they were with a home health agency, and so they provided home care so that the patient wouldn't have to go to the doctor's office. And I just loved the whole idea of it. And so I decided to do that. And I've been doing home health nursing now for over 20 years.
Wow, that's amazing. It's always great to hear a story about how somebody got involved and what they're doing, especially when it comes to caring for others, because it's truly a calling. And as you can see in Denette's life, it's a calling with her as well.
Yes.
So in your experience, what are some of the most common safety hazards you see in the homes of seniors?
Well, I can think of three that are really, really big safety hazards. One of those is footwear. I've seen quite a few patients fall or trip because they're wearing maybe slippers that don't have a back on them, and that is a huge fall hazard. I've also seen in a lot of homes quite a bit of clutter in the walkway area, and the most common area that they're going to be walking maybe from the bedroom to the kitchen. There's boxes or, books that are just on the floor that they're not able to lift up and move out of the way. And the third thing that I have seen a lot of also, and I have pets, I'm a big animal lover, so pets can sometimes get in the way of the elderly when they're trying to walk, either with a walker or if they're just, able to independently walk. The pets can get in between the legs or, just possibly get in the way, and the patient may turn around and not see them. So those are the three top things that I have seen in my nursing career as being real fall hazards.
And I love pets as well, but I know that even as somebody who is fairly stable on their feet, sometimes they can trip us up, and especially if we have mobility issues, I could imagine that would be an extra risk as well. A lot of families focus on fall prevention, and for good reason. What are some of the most effective ways to reduce fall risks around the house?
One of the things that I recommend is having some type of grab bar in the bathroom, in the shower area. It's really important. A lot of patients that I have seen sometimes don't have a shower chair to sit on when they're taking a shower. They prefer to stand, and it's slippery in there and they might slip. So if there's some type of grab bar in there that they can hold on to while they are showering, I think that is a really good safety or for fall prevention. One of the other things that comes to mind as well is making sure to group the most commonly used things together for the patient, so that they're not having to constantly be getting up from where they're sitting, because that can also cause a fall as well too. So like if they're in the bedroom area, having possibly the TV remote, maybe a glass of water, their nighttime medication close by, maybe even a hairbrush. People like to brush their hair sometimes before they go to bed. And having those things kind of grouped together makes it a whole lot easier for the patient to just reach over and get them instead of having to constantly get up to go get something. Those are the two things that come to mind right now.
That's really great advice and things that sometimes we don't think about. Just having things handy to reach that we take for granted. Take for granted that we're able to easily access things on tables and across the room. But for
Right.
somebody with mobility issues, we have to think about that, common things that they use. Thanks for
Right.
sharing that.
Sure.
Good stuff.
One other thing that I just thought of as well too is if they're using assistive devices like a cane or a walker, to make sure that they have it close by within reach and not having it in the other room, because I have seen that before where I've gone to see a patient and they come and answer the door and they're kind of like, I call it walking on the furniture, holding on, and I've asked, like, where's your walker or where's your cane, and they'll say, oh, it's in the other room. So making sure that they have that assistive device close by so that they don't fall, I think is really, really important as well.
Yeah, good stuff. Are there any areas families commonly overlook when it comes to safety? Maybe things that don't seem risky until they are, things you can think of?
One of the things that comes to mind is flooring. There may be a shift in the floor, or there may be throw rugs in the way. I know myself, I have a throw rug at home that I actually ended up rolling up and getting rid of because I kept hitting that corner part of the rug, and that's enough to trip somebody. So if there are any type of things that need to be repaired in the home, especially on the floor, I think that family really needs to take a look at that and try to get that fixed as quickly as possible, because it's a really bad trip hazard.
Yeah, and as you walk, a lot of times especially when our mobility is not as good,
Exactly.
we kind of scoot our feet as opposed to pick them up. So
Yes.
that makes sense, thinking about
Yeah.
the dangers of floor rugs and things like that.
Yes.
Okay, well, now beyond the home environment itself, equipment can really be a game changer. When you think
Yes.
about different kinds of medical equipment, it can not just be a game changer, but it can also be a hazard if not used properly. So
Correct.
what are some of best practices that you can think of when we're using walkers, oxygen, hospital beds at home?
Sure. So with walkers, I know that a lot of times walkers may be donated to a family, but it's really important to make sure that the height of that walker is adjusted to the patient, because you don't want to have it too low for them if they're a tall individual, and if they're someone who's shorter like I am, you don't want them to have the bars on the walker way up here, and they can't really see what they're doing. With oxygen, it's very important if the patient is on oxygen to have a poster that says oxygen in use posted outside of the home to remind family members that do smoke not to do that while the oxygen is in the home with the patient. And with the hospital bed, I've seen this so many times, falls. It's really important when a patient has a hospital bed that the side rails are up at all times when they are laying on the bed. Sometimes, I've seen people try to reach over without the side rail up, to grab the TV remote or their medication, and they can't reach it, so they end up trying to scoot over a little bit closer to the edge, and they have fallen. Another thing with the hospital bed I think is important too is that they can raise up a little bit, and it's just important to make sure that it's back down to the lower level when trying to transfer the patient out of the bed, or if the patient is actually able to get out of the bed so that they don't fall because it's at a too high height for them.
I see. Yeah, that's things you wouldn't necessarily think of as well. Thank you for sharing that advice.
Sure.
And I think about medications as well.
Yes.
And medications are necessary, and oftentimes as people get older, they take more and more medicines, it seems like, which can be
Right.
confusing and can sometimes be a hazard as well.
Absolutely.
So what kind of role does medicine management play in keeping a senior safe?
Medication management is a huge part of home health. And it's one that I actually love because it's a lot of teaching that we do with a patient and with a family on what new medications they may be taking. Or sometimes they see a supplement that is on TV that says it cures everything, and so they want to introduce that into their medication regimen, and it may be something that doesn't mix well with what they're already taking. I know as a home health nurse for myself, I have seen bags and bags of medication. Sometimes they're duplicates. Sometimes they are medications that they just stopped taking. So what we really recommend is a medication box, and having the nurse fill it for the patient, show them how to do it, show a family member how to do it. And it doesn't have to be a patient who's taking a lot of medications to have a medication box. I had one patient that was only on 2 meds, and he would forget or not remember if he had taken them in the morning or not. So then there was one day that he had taken it and he had forgotten and took them again and got really sick. So I recommended, a medication box. And even though it was only 2 medications, it was so helpful to him, and he was very appreciative because I showed him just put those 2 meds in there Monday through Sunday and leave the lid up after you've taken the medication. That way okay, I've done that one, and now I've got the rest of the week to take the rest of them. And so it's very, very important having a medication box to prevent anybody who may be confused or not remember if they've taken their medication to not possibly overdose on it. Very important.
I see those medicine boxes for sale at like your local drugstore and department stores and places, so they seem to be pretty easy to purchase. For those listening today,
yes,
that's
absolutely.
one thing they could probably do today even, would be go out and get a medicine box. And taking this advice from Denette, leave the lid open. I like that. After you take the pill and leave it open, don't refill it, because then
don't
you wouldn't
refill
know.
it. Exactly. Exactly.
Yeah. So for families that are wondering about when is it time to get some professional help, when's it time to call in home health, or when's it time to call in hospice, what's some advice you might give them, or some signs to look for even?
Sure. One of the signs that I have seen, I think that is important, is if you start seeing a lot of falling or losing of balance. One of the other things is maybe some confusion going on of whether they've taken their medication or not, or they're not sure if they're supposed to be taking medication that was prescribed. One of the other things I have seen too a lot of is if they keep getting recurrent urinary tract infections. That is a big deal. We need to get to the root of the problem and find out what is going on. And with the doctor's help, we can help manage that. We can help with teaching on how to prevent them and signs to look for when a UTI may have occurred. And on the hospice side, a diagnosis that is 6 months or less that meets the hospice criteria is very important as well too, because what I have seen is that sometimes families and patients wait a little too long before they reach out to hospice, and it ends up being a very painful experience for not only the family but the patient as well. So getting that education and just making a phone call to a home health agency to just ask those questions. I have a family member who I see falling quite a bit. Their balance is kind of off. They have new medications. They're confused, or they may have a terminal diagnosis as well too. But I think that with hospice, what I have seen is that there's just a bad connotation that goes along with it, that they're not going to get their medications, they're just going to starve. And that's not the case at all. With hospice, it's a whole team of people. There's nurses, chaplains, social workers that care for the patient and for the family, because they're going to be the ones being left behind. So I think just getting educated on the process and what it's all about is taking a huge step, and just letting the family know that we're there for them. We work as a team, and don't ever be embarrassed to just call and ask a question.
And I've heard before that of stories about where people were actually on hospice and then improved. And so you can actually go on it and then come off. Is that correct?
That's absolutely correct. What we have seen a lot of times is patients that go on to hospice actually get better. Maybe their disease process is still not curable, but we've been able to maintain their symptoms with medication, and just having a more of a team approach involved in the hospice situation has worked out really well. And then we've had some that have graduated but still need help, and then can go on to home health to stabilize other things that are going on with them.
Yeah. That's always good to know. Sometimes I think people get the idea that if you're on hospice that there's no going back, for instance. And so we want people to know that sometimes you get better, and that's okay.
And that's great. We want that to happen, if possible.
Sometimes the most powerful lessons come from real life moments. Do you have some kind of a story or an example where a simple safety change made a big difference for somebody?
I do. Actually, this happened a couple of weeks ago. I had gone in with one of our physical therapists to see a patient for a PT eval, and she is using her wheelchair quite a bit because she had a fracture, and she had a bedside commode, and the bedside commode was closer to the bathroom. And so all we did was just move it closer to the bed. I mean, you would think that, okay, that's not that big of a deal, but it actually was a huge deal, because that would have been a big fall for her, trying to get from the bed to the bedside commode that was closer to the bathroom. So just that little bit of just moving it closer for her made a huge difference. And the therapist was actually able to see her get off the bed and onto the bedside commode safely.
Wow.
Yeah.
One little change.
One little change
makes a big difference in the
Huge.
safety of somebody's home.
Absolutely.
So if you could leave caregivers with just one golden rule or piece of advice about home safety, what would that be?
Take a look at your parents' home and look at the flooring. Look at the pathway from one room to another. Is it cluttered? And maybe it's not so much that the parents like to have it that way. Maybe they're just not able to move those items out of the way. So, being proactive and just checking out the area to see if it's actually safe to walk. The other thing, like I mentioned earlier, is taking a look at the bathroom, the shower situation. Are there grab bars in there as well too that can help prevent a fall? And most importantly, making sure that any assistive devices that they are using, that they're within reach. And also grouping those things together that they use most often in one place for them, so that they're not having to constantly be getting up and going to a different room to get the things that they use on a daily basis.
Thank you so much. Great advice, great practical stuff in order to help people just succeed at home. And companies like ATEX are focused on helping you make the best of your home life.
Yes.
and enjoy home in a safe manner as long as possible. And because everybody wants to be at home when they age.
Yes.
Before we wrap up, I want to share a helpful resource that can really make a difference. Our one practical tool I recommend is the CDC's Check for Safety checklist. It's a simple but powerful tool that walks you through each room of the house and helps you identify hidden fall risks. Whether you're just getting started or you're reviewing an existing setup, I encourage you to find that checklist, even work on walking through the rooms with your loved one or whoever it is you're caring for, and make a weekend project out of making some adjustments to make home a safer and better place. We're going to include the link to that in the show notes so you can download it and start today in making your home safer. So that's it for today's episode of We Help You Home, and a huge thank you to Denette for sharing her expertise and care with us today. Your insights making a difference, and your work makes a difference in people's lives now. And I appreciate that, and I appreciate the work you do and the care you give to help others.
Thank you.
And it's truly rewarding, isn't it, when you get to
is.
invest in the lives of others?
Absolutely, it is.
If today's conversation helped you feel more prepared or confident, we'd love for you to subscribe, leave a review, and share this episode with someone who could benefit. You could also visit atexhealth.com to learn more about our incredible services and Denette's incredible company and her team. Thanks for listening to We Help You Home. I'm Rob Steinbrook. Take care, stay safe, and remember, we're here to help you home.